Good afternoon, and welcome to the Lynn Cancer Institute updates, what we all need to know in 2021. We're very grateful to have you all with us today and to learn from our department's newest social worker, Sabrina Spratt. We're happy to have her, and we're happy to have all of you here with us today. Sabrina will be educating us on understanding and living with cancer-related fatigue. At the Lynn Cancer Institute, in our support services department, we believe that treating the whole person will truly have a positive impact for our patients. We invite you to take notes. Your Zoom will be muted during her presentation. So when you have a question, please put it in the chat box or the Q&A box. Sabrina will not be able to see you or hear you during the presentation, so your question has to be in one of these areas for her to be able to answer it. There will be time at the end of the presentation for all the questions to be answered. We're very happy to welcome you to the Lynn Cancer Institute and very proud to introduce our social worker, Sabrina Spratt. Sabrina.
Good afternoon, everyone. Thank you so much for joining us. I'm so excited to be able to share this information with you. So today, the presentation that I have put together for you guys is research that I've personally done from reputable websites and medical journals. But I just want to start off by reiterating that everyone is different. So everyone's experience with a cancer diagnosis is different, and symptoms of fatigue will look different for everyone. I also wanted to let you guys know that I'm going to be sharing a good bit of information, contact information, and different locations around our facility. So you can feel free to take notes, but we'll also be sending out an email at the end of the presentation, and all of that information will be there. So these are some of the commonly asked questions that both myself and my coworkers have received about fatigue. And these questions that you see here are an outline of the major topics that I'm going to cover today. We're also going to touch on some more of the tangible and practical resources that can help to manage and reduce fatigue. So these frequently asked questions include: how long will I feel tired and lack motivation? Is this fatigue, or could I be depressed? Should I alter my diet? And I have no energy at all. Even getting out of bed is exhausting. What can I do? So we're going to start with general fatigue. And I'm sure that this is something that we've all felt before, even before the pandemic. So feeling tired with low energy and a strong desire to sleep that interferes with normal daily activities. Cancer-related fatigue, according to the National Comprehensive Cancer Network, is a distressing, persistent, and subjective sense of physical, emotional, or cognitive tiredness and exhaustion related to cancer that interferes with usual functioning and does not dissipate with sleep or rest. This is a really good definition, but I just wanted to break it down a little bit more for you guys. So cancer-related fatigue is physical, emotional, and/or cognitive exhaustion that's a side effect or a symptom of your cancer diagnosis or treatment that does not get better with rest. Many patients experience cancer-related fatigue that can range from mild or manageable symptoms. For some patients, it's only a few hours or a few days, and after a bit of rest, you feel better. And for some patients, it can be even months or up to years post-treatment. Some patients may need to rest just a few extra days in bed or stay longer in bed in the mornings. And for others, cancer-related fatigue can look like needing assistance with daily activities of living, such as feeding yourself, bathing yourself, and getting dressed. Cancer-related fatigue is also multidimensional in its manifestation and impact. Its effect on the quality of life of the patient is comparable to that of pain and leads to a loss of productivity, which can reduce self-esteem. So I wanted to share this quote with you guys. I feel like it's super important just to show that even though cancer-related fatigue isn't something like a broken bone or a blood test that we can see that's tangible, but it still has such an impact on your lives. So who is susceptible to cancer-related fatigue? Every patient who has a cancer diagnosis. Symptoms can vary based on your overall health, the specific type of cancer that you have, and the treatment plan that your treatment team has come up with for you. So causes of cancer-related fatigue that are directly associated with treatment include the stress of a cancer diagnosis, surgery, chemotherapy, radiation, some biological therapies, medications, infection, pain, anemia, low thyroid function, or low blood pressure. So some types of cancer-related fatigue that you can control include things like poor nutrition, dehydration, not sleeping enough or sleeping too much, and not being active enough. Check in with your nurse or doctor. If you feel tired and it doesn't get better with rest or sleep, it keeps coming back or becomes more severe. You're more tired than usual during or after an activity. You're feeling tired and it's not related to an activity. You're too tired to do things that you normally would do. Your arms and legs feel heavy and hard to move. You've no energy at all. You feel very weak. You spend more time in bed or more time sleeping, or you have more trouble sleeping. And you become confused or can't focus or concentrate your thoughts. Or your tiredness disrupts your work, social life, or daily routine. So your doctor or nurse may suggest a physical exam, alterations or additions to current medications, blood work and other diagnostic tests, or they may refer you to a physical therapist, an occupational therapist, a registered dietitian, a palliative program, or an oncology social worker for assistance with self-care methods and emotional support. So next, we're going to look at cancer-related fatigue from two separate angles. So the first is treating fatigue directly, and this includes things like anemia, infections that you might have come in contact with, endocrine disorders, or renal dysfunction, and that leads to dehydration, or treating symptoms of fatigue directly, such as insomnia or hypersomnia, pain, immobility that can lead to deconditioning of our bodies, depression, and anxiety. So we're moving on to emotional fatigue or emotional exhaustion. And this is feeling emotionally worn out and drained as a result of accumulated stress from your personal or work life, or a combination of both. And I'm sure that this is something that we've all felt before as well. So depression or fatigue. Clinical depression is a serious mental illness that is not a normal reaction to difficult news. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. It's also called major depressive disorder or clinical depression. It affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living. And I do want to note that there is a difference between depressed mood, feelings of sadness, and a clinical depression diagnosis. As clinical social workers, we assess our patients for depression. Specifically, we utilize what's called a distress screening tool, which you'll see on the next slide. Because fatigue and depression are so similar, it is important that you share your concerns with your healthcare team and monitor any symptoms or feelings that you're experiencing. So here you can see an example of our current distress screening tool that we use here. As oncology social workers at an accredited cancer institute, we utilize distress screens to help us get a snapshot of how our clients are feeling. During our first meeting with patients, we assess for a history of depressive symptoms or a clinical depression diagnosis, and assess for current feelings of sadness and depression. Some causes of emotional fatigue as related to cancer include receiving the news of a cancer diagnosis, making treatment decisions, grief, family stressors, financial stressors, existing anxiety or depression, and caregiver fatigue. So caregiver fatigue is physical and emotional exhaustion of looking after a care recipient, often a loved one, a close friend, or a family member. I think it's really important to note that just as important as it is for our patients to feel heard and supported, it's just as important for their families and their caregivers to feel the same. I want to take a second to really shout out our caregivers because they are so important to our patients and their success. I also want to recognize our patients who themselves are caregivers. Being a patient who is also a caregiver to a loved one can further exacerbate these symptoms of fatigue. Here at the Lynn Cancer Institute, we do have a caregiver support group that is run by a licensed clinical social worker. It meets once a month to offer support and a safe community. To be eligible for this group, you must be a caregiver for an individual with a cancer diagnosis who is currently going through a cancer treatment or is up to 1 year post-treatment. So many symptoms of fatigue and depression overlap. Fatigue is embedded in clinical depression, and symptoms of one diagnosis can often mirror another. So these symptoms include things like decreased energy, anhedonia or a lack of pleasure in things previously enjoyed, increased need to rest, decreased motivation, sadness, frustration, or immobility that again leads to deconditioning and weakening of our body, insomnia or hypersomnia, decreased concentration or attention, and perceived short-term memory problems. So research shows that it is difficult to tell the difference, but many treatments for depression and fatigue are similar and effective to treat both. Memorial Sloan Kettering states that about 60% of cancer patients experience fatigue and about 20% experience clinical depression. Depressive symptoms due to fatigue are less severe than true depressive symptoms. I thought this was a really important fact to share with you guys, just to point out that sometimes when we're feeling those feelings of depression and sadness, it often can be cancer-related fatigue. So now that we've talked about the basics of fatigue, I want to discuss some helpful tools that I hope you guys can use and keep in your toolbox to combat fatigue. So first, we're going to start with emotions. So remember that fatigue is normal. Fatigue can lead to decreased self-esteem as it hinders you from completing tasks and continuing the same activities that you may have done prior to your cancer diagnosis. Reach out and talk to your support systems about how you're feeling. Speak to an oncology social worker at your cancer institute or hospital, or a psychiatrist or psychotherapist in your area. They can assist in normalizing and reframing thoughts about fatigue and improving coping skills. Support groups and mentor groups are also a great resource. Specifically here at the Lynn Cancer Institute, we have a mentor group called Linking Hope. We have cancer site-specific support groups. We have our caregiver support group, and we have a wellness program called New You. Try your best to continue to do things that you loved pre-cancer and pre-diagnosis, even if these things are done less often or for shorter periods of time. And you can also think about things like mind-body techniques, and these include massage, mindfulness, music therapy, onco-acupuncture, and things like that. I do want to note that because of COVID, we had some things that were on hold, but onco-acupuncture is actually back. So if you guys are interested in that email that we're sending out at the end, we'll have some contact information and you guys can reach out to us. So next, we're going to talk about rest and activity. So as much as you feel that you need to rest, exercise has been shown to decrease fatigue. Always double check with your medical team. Try some moderate exercise regularly. A 20-minute walk, yoga, or a stretch class can always be helpful. And it really shouldn't be exercises that exhaust you, but more things that you enjoy and keep you moving and keep your body conditioned. Try to exercise in the morning or throughout the day and avoid evening exercises. Take naps when needed and try to keep it about under 30 minutes or do something active after your nap. You can also look into things like keeping an activity log. List your activities and the times that you do them, how long you do these activities for, and how you feel once you've completed them. So prioritizing can also be really helpful in conserving energy. So you can think about things like what has to be done, and if those things can wait a little bit. And if they must get done, who can help you to complete them? Scheduling important activities when you have the most energy can also be really helpful. So next, we're going to talk about nutrition. So some nutritional related causes of fatigue include skipping meals, unbalanced meals, not getting enough calories, not getting enough protein, nutritional deficiencies such as anemia, dehydration, nutritional related side effects of cancer and its treatment. And these things can include loss of appetite, nausea, diarrhea, constipation, your caffeine intake, and your alcohol intake. So avoid alcohol, caffeine, sugar, and chocolate, and nicotine, especially at night. It's important to remember that your body is healing and it's trying to produce new healthy cells. And to do that, your body really needs the right fuel. Try to eat small, well-balanced meals and snacks throughout the day. Eat a snack every 3 hours or so just to keep up your energy levels. Try to incorporate fiber, diversify the color of your meals with veggies and healthy fats, and stay hydrated. 6 to 8 glasses of water a day. If you have any questions, contact your hospital's team of dietitians. And I also want to talk about our incredible cancer nutrition support group. This is called Soup to Nuts. It is run by one of our dietitians, Brandy Hyatt. She's really passionate about this group, and I think it's really informative. And this is open to members of the community who are currently undergoing any type of cancer treatment and up to 1 year post-treatment. So now we'll touch on some tips to consider to help conserve energy and optimize sleep. So prioritize and delegate tasks if needed. Rest before you become fatigued. And we'll be talking about a fatigue journal, which can help to keep track of your fatigue symptoms. Turn off TV and electronics 1 hour before you go to bed. Listen to quiet music, read a book, or take a warm bath. Try to do these things in another room. Make your bedroom only for sleeping. Keep a regular sleep schedule, even on the weekends. And if you haven't fallen asleep in 15 minutes or so, try to go to another room. Avoid mental stimulation and go back to bed only when you're tired. So now we're going to talk about keeping track of fatigue symptoms with a fatigue journal. A fatigue journal can be extremely helpful when you want to keep track and notice patterns and symptoms, and it may aid you in discussing symptoms with your medical team. So some examples of topics that you can monitor are: when are the symptoms the worst and how long do they last? When did your symptoms begin and what are those symptoms? Does anything ease your symptoms or worsen them? How do these symptoms affect your daily life? How are you eating and sleeping? How are you feeling emotionally? What does your exercise routine look like? And from 0 to 10, how fatigued or tired do you feel in the morning, afternoon, and evening? So this is an example of a fatigue journal that I created, and it will go out in the email so you guys have this as a tool to use. And it discusses some of the things that I just listed prior. How you're feeling from 0 to 10 in the morning, afternoon, and evening, how you feel your sleep, your quality of sleep was, and how many hours that you've slept, the activities that you did, any exercise, what your sleep routine looks like, what you may have eaten and at what times, and any additional notes that you feel like may be important. So some practical tips to managing fatigue include asking for assistance with completing daily tasks from family members, neighbors, and local organizations. And I know this is something that can be really hard. Sometimes we don't feel like we have the ability to reach out, but you can always reach out to an oncology social worker, your church, or your synagogue, and we can always offer you resources. If fatigue is severe, you can utilize a walker or a wheelchair when needed. And I know sometimes there's a stigma attached to using these tools, but these tools can be really helpful to help you feel stable and confident when moving. And they can also help you to save energy for some events that might be more important to you. Sitting instead of standing. Higher seats makes it easier to stand. Squat or bend at the knees to pick things up. Install grab bars or a chair in the shower, and sit to towel off or use a terry cloth bathrobe. You could think about using hairstyles that are easy to care for, maybe short. Sit on a chair or the edge of the bed to dress. Wear slip-on shoes, shirts that button at the front. And I also wanted to let you guys know about this incredible resource that we have here. It is called the Gloria Drummond Physical Rehabilitation Institute. For those of you who know where we are at the Lynn Cancer Institute, this building is right across the street from us. They have a really great team of physicians, physical and occupational therapists, nurses, nutritionists, exercise physiologists, and they all work together to include you and your families and your personal physicians. So to wrap up, fatigue is totally normal. Do your best to keep track of your symptoms with a fatigue journal. Talk to your medical team if you have any questions or concerns. And there are resources and support out there. You are not alone. So thank you guys so much for joining me. If you guys have any questions, I think Jan's going to read them for me.
Yes.
We will.
Okay, thank you, Sabrina. That was awesome. Questions. Is there still a diagnosis of depression due to medical condition? And is that what we have? So I guess the question is there a diagnosis of depression due to the medical condition? I think you said that there was a small percentage in your presentation, small percentage of depression due to a cancer diagnosis.
So I'm not sure I understand the question. I apologize. So the symptoms can overlap, but if this would probably be a better question for your medical team, because sometimes the symptoms do overlap, and if there is a physical, biological reason for a fatigue diagnosis, it may not include a depression diagnosis on top of it.
And I think also I just wanted to join in. Hi, I'm Darcy McNally. I work on the team as well. When we think about depression, depression globally is a diagnosis that people have. When you get diagnosed with cancer, that may be the catalyst for why suddenly depression starts. It could be the trigger. And what Sabrina talked about is that sometimes it's hard and to recognize that you can have depressive symptoms because of your fatigue that are not necessarily considered a clinical depression. Cancer itself will not cause depression, but it can certainly enhance or make or might be the catalyst and the trigger of the depression. I think it's important to understand that. And there are certain cancers that depression is more prevalent in. So for example, people that get a diagnosis of pancreatic cancer, we find higher rates of depression. But again, I think speaking back to what Sabrina said, it's just very important that everybody know that if you're not feeling like yourself, if you're recognizing certain symptoms, that you have a team of social workers and other medical professionals that you can kind of tap into to ask the questions and see if you can get the support and get these things kind of diagnosed properly. So thank you.
Are there any other questions? If not, I think Sabrina, everything that you presented was so comprehensive that you probably covered any questions that anyone may have.
I hope so. And if anyone has any other questions, you guys can reach out to us or your medical team. And again, thank you guys for coming and enjoying.
And I just want to say thank you to Sabrina.
And I want everyone.
I'm sorry, Jan. I just wanted to say to everybody, when you get your information on this, if there are other topics that you want us to present on, we are just a wealth of knowledge, and we want to be very inclusive and provide whatever support and information we can. So you can include that in some of your feedback as well. Jan, did you say? Okay.
So all of our lectures are recorded. So if you want to, I know Sabrina said she's going to send out a follow-up to this presentation, but also if you'd like to watch the entire presentation again, or if you would like to share it with family and friends, Lee will be sending out a follow-up as well. And along with that follow-up will be included an evaluation. And we really appreciate the evaluation. And as Darcy just said, if there's any other topics that you would like to learn from, especially from our social work team, and we already have Marie, our oncology dietitian, that presents about once a month, let us know. And also with the evaluation, we are then able to add your name and your contact information, so you will be on our mailing list to receive information on any of the programming that we're providing. And we do want you to know that we'll be having one more presentation this month. This week, Friday, November 19th, we will be presenting on updates in screening, early detection, and treatment options for lung cancer. The presenters will be Doctors Jonathan Stern, John Roberts, Sam Richter, and Matt and Matthew. So we hope that you can join us for that presentation. And thank you, Sabrina. And thank you, everyone, for joining us, and have a great afternoon. And I think I better take a walk because I can't take a nap. Thank you, everyone.